We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers declining throughout the country and here in Orange County, many residents are questioning what we should do next. Orange County government has lifted its state of emergency, but is still suggesting that residents wear face masks while indoors. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings to give us an update on what's going on here in Orange County. Mr. Mayor, thank you for being with us today.
Well, first, let me begin by saying hello to you and everyone. Yes, we do always maintain being busy here within the county. We have a lot going on. But I will tell you that overall, Orange County is in a pretty good place at this point. We're well into our economic recovery after the pandemic, while we're still in the pandemic, but our numbers are relatively low. We are no longer under a state of emergency. On October the 27th, we came out from under the state of emergency that was caused by the significant increase in the rate of transmission for the coronavirus within our community. We've contained it now. Our 14-day positivity rate is around 3%, which means it's under 5%. And by the CDC guidelines, once you get to that point, you have effectively contained the virus within your community. But it's really no time for us at this point to get too relaxed, because we still have a ways to go. Our goal is to get to where there are zero transmissions, zero new cases, zero new deaths within our community, and we're not yet there.
And Mayor Demings, you mentioned the state of emergency being lifted. What does that mean for residents or employees here in Orange County?
When we're on a state of emergency, it really allows me as the mayor of Orange County, the crisis manager during a critical incident, to forego some of the procurement requirements. I get to make some decisions on behalf of the county employee as well as the citizens to put various ordinances, temporary ordinances and directives in place. And for the citizens, that means that they can look to essentially one person throughout the county to be the lead crisis manager. That is pursuant to county charter. And so I have enjoyed this opportunity that I've been given to be in a leadership role. And I'm thankful that I have 40 years of crisis management experience to bring to the table. With this pandemic, it has been a pandemic that has had its ups and downs. It's been fairly dynamic. So there have been times when we thought that the pandemic was over, and then it reared its head again. So what I say to everyone is we have to be cautiously optimistic during this remaining period of time. Those who have not gotten vaccinated really should consider getting vaccinated. And if you can't, for whatever reason, then you certainly should consider, when you're in crowded spaces around people you do not know, you should consider wearing a facial covering. If you're outdoors and you can socially distance, that's a different thing. And I think that if we're able to do that for the next month or two, we should, by the time the new year rolls in, we should be in a better place. Of course, this week, the CDC and the FDA approved the distribution of the Pfizer vaccine to children between the ages of 5 and 11 years old. Our Orange County Public Schools has a plan of action within the next few days to be able to distribute the vaccine to those children at numerous schools here within Orange County between the hours of 4 p.m. and 8 p.m. There's a list in our local newspapers, on our county website, as well as on our local news stations' websites. You can get plenty of information that's out there about that. Orange County here very soon will be making available at our Barnett Park location the opportunity for parents to take their children to be vaccinated or inoculated as well. And we will continue to provide testing and vaccine for adults at Barnett Park also.
And speaking of, we know that even though the state of emergency has been lifted, we are still encouraging people to get vaccinated, their initial vaccination, and also for people who need a booster. And as you mentioned, they can go to Barnett Park. But are we also still pushing for people to get tested as well if they're feeling symptoms or they're not sure?
At this point, absolutely. We don't want the hurdle to be that people have to pay for the testing. It's free testing. We are fortunate that we have received adequate federal funds to be able to acquire the testing kits as well as the vaccine. So you shouldn't be paying for vaccine anywhere because there will be an abundance of that available. I will tell you that there's over 100,000 of our residents who got the first dose of the vaccine and did not get their second dose, according to the Florida Department of Health in Orange County. What that really means is that those individuals do not have full protection from the virus, and they really should consider getting their second dose. Also, the booster shots are now available for various age categories, and that is something that if you have not had your booster and you're beyond that 7 or 8 month period of time, you really should consider getting your booster as well. If we do all of this, this will allow us to, I think, run through the finish line and not see a resurgence of the virus within our community. We have about 76% of our residents who are eligible, who have gotten vaccinated at this point. So that's a pretty high level of individuals who have gotten vaccinated, at least one dose. In terms of those who are completely vaccinated, we're at about 66%. So I believe with children, young children having this opportunity, it's good for the children, good for the adults who are around the children. That includes their parents or grandparents and or the faculty and staff there at our Orange County Public Schools.
So tell us about the hashtag I Got My Shot campaign.
The I Got My Shot campaign is one where we have a mobile vaccine trailer that moves throughout the community. We try to go into those underserved areas. We try to make certain that we're making the opportunity to get vaccinated available to even the homeless individuals within our community, or those who may be constrained by the lack of having adequate transportation. So we take the vaccine trailer right into their neighborhoods so that they can really walk up to the trailer and get vaccinated. That will continue for a while, and so we hope again that as a community, while we are reopened for business and others are coming in, that there's still a potential that the virus could infiltrate us here within this community. Just earlier this week, last week, the president announced that they were reducing the international travel restrictions, and primarily from the United Kingdom. So many of the individuals from Great Britain will be traveling here into our community during the holidays, and there are certain things that they have to do in order to enter the country. But we also should have strong domestic travel during the holiday season, where individuals will come from throughout the United States who will come and visit with us. Our weather will be good, because of our climate here in Florida and Central Florida. It is likely that we should see a number of visitors during the holiday season. That helps our local economy, and so we all should be prepared for that. We're going to have some challenges with the supply chain because of the lack of drivers, truck drivers, and other delivery personnel. We've had some challenges with even our seaports, with ships being able to come in to port and unload. So it is really a global impact that we have seen from this pandemic that is affecting us in a number of ways. Goods and products have been slow to enter into the country, so not quite sure what that means for the retail season that is tied to the holiday season, but I remain optimistic. So we certainly want everyone, as we approach the Thanksgiving holiday period, to be prepared, to have some fun with family, to do the right thing, to re-engage, to spend some time with their families, and do it in a responsible manner.
Absolutely. And, you know, there are still, Mayor Demings, some people who have, residents of Orange County who've been impacted by COVID-19 economically. Are there still COVID-related programs available to Orange County residents to help them through this period?
Yeah, absolutely. If you are chronically rent stressed, if you're behind on your rent payments, there's an opportunity for you to get assistance. You can get assistance for up to $30,000 at this point. If you're behind on your rent, you can get payments if you had a COVID impact. And you can even, going forward, prospectively, we are providing dollars rental assistance for up to 3 months going forward into the future, but you can go 12 months or so in arrears to catch up. And as a result of that, over 2,200 families have been able to remain in their apartments or rental units at this point. But also here within the state of Florida, the state has a program for mortgage assistance. And so that if you are behind on your mortgage payments, potentially facing foreclosure, you can apply through the state to get assistance with your mortgage payments. And that is a derivative of federal funds as well. And so there's help out there. If you need assistance with your utility bills, we have a low-income heating and energy assistance program here within Orange County. And you can go to our website at ocfl.net/rental assistance and to receive information about these various programs that I just talked about.
Well, Mayor Demings, thank you so much for being with us today and keeping us informed about how we move forward in getting over this pandemic. We appreciate your time.
I enjoyed it, and also this year we'll be doing our Christmas toy drive for children. If you want to be able to donate toys, you can simply go to our website at ocfl.net/toy drive, and there's more information there about how you will be able to contribute and help those in need in our community.
Well, thank you so much. We'll be right back with more. Stay with us. Let's get an update from our state medical professionals. And joining us is Alvina Chu, Infectious Diseases Division Director with the Florida Department of Health in Orange County. Alvina, thank you for being with us today.
Thank you for having me again.
So, Alvina, tell us, where are we in Orange County and in the state of Florida in our fight of the coronavirus and the COVID-19 pandemic?
So we are really encouraged to see that we are in a continued decline of cases, which has been happening over the last several weeks. Currently, we are at 54 new cases per 100,000 population. That's our 7-day incidence average. And then we're also at 2.85% positivity for a 7-day average. And so those numbers put us basically on the cusp of moving from a substantial level of transmission, which is orange, to a moderate level of transmission, which is blue. So when we go below 50 new cases per 100,000 is when we will move down to the next category. And so that is the most encouraging information that we have now. And we've also seen a significant decrease in the hospitalizations and deaths resulting from COVID for the preceding months.
So it is the blue level of a still ongoing pandemic, so that people understand that. Why do we need to stay? We need to stay vigilant. Why is that?
We do, because this decline is, if we want to keep up the decline, I think we do need to remain vigilant, which includes increasing the vaccination for those persons who are unvaccinated. So we still do, unfortunately, have hospitalizations occurring, and unfortunately, there are still deaths that occur due to COVID-19 infection, and these hospitalizations and deaths and severe outcomes are predominantly, greater than 95% of these are in unvaccinated persons. And so the vaccines will help us increase the community immunity to tamp down transmission and then also protect those who are the most vulnerable.
And there's a lot of talk about those who are fully vaccinated getting their boosters. Why is that necessary if you're fully vaccinated?
Well, so there are certain persons who are at higher risk. And so for those persons who may not have been able to mount a good immunity on the first two doses, and so those persons with compromised immune systems or those persons who might have underlying health conditions, it is recommended to help increase their immunity by getting a booster vaccine. And so certainly those who are 65 plus, those who are 18 plus, who are more medically vulnerable, and then also those persons who are 18 plus who have some increased level of exposure due to their occupation, such as those persons who are working or living in long-term care facilities or healthcare workers.
And now that vaccines have been approved for children, how would you suggest that parents talk to their kids about the vaccine?
Well, so we know that COVID-19 can still, it does affect children, and it's sort of the myth or the common thought is that children aren't affected much or affected very little. And while they have experienced fewer hospitalizations and deaths than for those in adults, these COVID-19 infections can result in potentially long COVID, which we still don't understand very much about. So symptoms that may last for a very long time, and for some people may be quite debilitating, neurologic symptoms, memory symptoms. And then also children can be affected by MIS-C or multi-inflammatory system syndrome. And so these can be quite devastating in children. And so a COVID-19 shot would protect them from these severe outcomes. I guess it's always a tough sell for a child to put a needle in the arm, but it's the longer term protection or the protection of their health, I think, would be the primary point.
Yeah, it's just another vaccination. They've had others. So is the health department getting any pushback from the public related to children and the vaccine?
So that would not be a new thing that public health or the health department gets pushback about vaccines. So we've had excellent, in the previous past, we've had excellent response to, vaccine rollouts. I think if we think back to those days where we were pre-vaccine, childhood deaths or hospitalizations or severe outcomes from vaccine preventable diseases was heavy on everyone's mind. So I wonder if maybe over time, people may have forgotten how severe diseases can be without our great preventative medications such as vaccines. We've had a lot of interest expressed from parents about getting their children who are 5 to 11 vaccinated. And so we hope that after we are able to vaccinate those children, other parents can see and other children can see that it really is a good preventative measure, the best preventative measure for COVID-19 right now.
And it's already been reported that the Mu variant has been found in wastewater in Seminole County. What should we be doing to continue to keep ourselves safe?
So the Mu variant would be not, we wouldn't treat it any different than any other COVID-19 or SARS-CoV-2 virus. We would still recommend that even in this decline, so that we can keep the pressure down on the virus, that we continue our good pandemic precautions. And as you know, we are in flu season. So these pandemic precautions work for the flu, all other cold viruses, all other respiratory type viruses, and they help us prevent not just COVID-19. So good hand washing, frequently, often, wearing a mask to help prevent or reduce the transmission of respiratory viruses, and also, watching or maintaining a good physical distance, avoiding large crowds indoors in poorly ventilated spaces. So these are still those measures that can help us prevent a variety of infectious diseases, including COVID.
Well, Alvina, thank you for being with us today and keeping us informed about this ongoing pandemic. Thank you so much.
Thank you. Thank you for having me.
And we'll be right back with more. Stay with us. The CDC recently approved the COVID-19 vaccine for children ages 5 through 11. And Dr. Thomas Lacy, Medical Director for Florida Primary Care with Nemours Children's Health, is here to explain more. Dr. Lacy, thank you for being with us today.
Oh, thank you, Clarence. Thank you for having me. I'm excited to talk about this.
Yes, Dr. Lacy, why is it important for eligible children to receive a COVID-19 vaccine since it has now been approved by the CDC?
Yeah, thanks. It's really important for two reasons. On the individual level, vaccination is the cornerstone for healthy children. So, to keep our children healthy and prevent them from getting illness, vaccination accomplishes that. And we know the COVID vaccine is very effective at accomplishing that. On the bigger level, regarding our population, the better control we can have to have people not get infected and spread the disease from one person to the other, the sooner we're going to get out of this pandemic. And children are known to be spreaders of viral illnesses. So getting them vaccinated is important to control it in our entire population.
So many adults, millions of adults, have already had the vaccine. Is the dosing going to be the same for children as it is for adults?
So the dose for kids who are 12 and over is essentially the same as it is for adults. The dosing for children between 5 and 11, in other words, until their 12th birthday, is a third of the dose for over 12 and adults.
So for parents who are concerned about the vaccine, about its safety or its efficacy, what would you tell them to assure them that this is the right path and the right thing to do for their kids?
Yeah, it's a great question, and we get asked this a lot. So first of all, in terms of vaccinations in general, they're very safe. There has never been a vaccine that had a lifelong, negative effect. We've just never experienced that. And this vaccine has been given to over 4 billion people around the world. So we're not seeing any bad effects from it, and that's kids and adults. So we're very confident this is a very, very safe vaccine. So when I talk to parents about vaccines, and COVID is an example of this, we know that you can get COVID and get seriously sick and die, have significant problems from the disease. So the vaccine, we don't believe any of that happens at all. In fact, the evidence points to the other direction, that doesn't give any long-term effects. So let's vaccinate to prevent the disease that we know can give you lifelong problems or death.
About 100 years ago, when I got the MMR vaccine, it really didn't take a whole lot of discussion from my parents to talk about the vaccine. We just did it. In this case, it's a little different, and kids are hearing things that we didn't hear as young people. So how would you tell their parents to talk to their kids about this vaccine and sort of tune out some of the noise that they may be hearing on social media and other places?
Yeah, you're exactly right. I mean, there's a lot of things everyone hears, the parents, the kids, everyone hears. So, parents want their kids to stay safe, right? And our children know our parents want us to be safe. So, this is the example of how parents talk about this is how I'm going to help keep you safe. I'm going to help keep you from getting this disease that could be serious and make you sick and go in the hospital. So it's all about keeping your child safe. And children are used to the parents telling them to do things to stay safe, like don't run in the street, right? So it's really a normal parent conversation. We just have to focus on the vaccination part.
There are a lot of things that I would love to have you clear up that are out there, the rumors about, for instance, the vaccine and infertility later in life for kids and things like that. What about that myth particularly?
Yeah, there's absolutely no evidence to that. This is just conjecture that some people introduced into the conversation, but we're scientists. We believe in data. We study these things and look at these things, and there's clearly no evidence to support that. And that's why the American College of Obstetrics, the American Academy of Pediatrics, the American Academy of Family Physicians, everyone is unanimous that this is not going to affect fertility, as well as that it should be given to pregnant women as well, because we know that pregnant women sometimes are at higher risk for severe disease and death than people their same age who aren't pregnant.
So, Dr. Lacy, what would you say to parents who just aren't sure because they have been hearing all of this chatter about getting their kids vaccinated? What would you say to them and tell them to do?
I would say to them, we all want to keep our kids safe. Like I said, as a parent, that's one of our jobs, is to keep our kids safe and healthy. And clearly with COVID disease, the best way to keep your children safe and yourself is to take the vaccine so you don't get the disease. Preventing the disease is the key. We talk about treating the disease, but better than treating a disease is preventing a disease. And that's true like the MMR that you talk about that you got. Measles is a very significant illness. So let's don't get the illness so we don't have to worry about getting severely sick from it. It's the same logic for us.
Well, Dr. Lacy, we so appreciate you being here and keeping us informed, because we know that you're on the front lines of this pandemic and how important it is to hear from actual experts, real information. So thank you so much.
Well, thank you for having me and giving me the opportunity to talk about this, because it's such an important topic right now. Thank you so much.
Absolutely. And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.